So now that we've kind of established this foundation, what we're going to do is move on to the 6 components of reading. There are 6 things that need to happen in order to see those words on the page, comprehend the meaning, and retain that meaning. And the first is obviously our vision, sensing, being able to sense what's on the page through our eyes. So it's really important if someone is experiencing a reading struggle, have those eyes checked. Make sure that they don't need glasses or contacts. Number 2, auditory sensing. Whatever strategy you use for reading, it is going to be incredibly helpful to be able to hear those phonics sounds properly. So again, everyone at some point every child should probably have their hearing checked to make sure that they are getting those sounds. Number 3, visual perception. Now this is really where our program takes off. This is where we're going to get into the meat of the program here, because how you process visual information, how you perceive it, and specifically those two-dimensional symbols and letters, that could pose a problem. Now in its extreme, this is going to probably result in something like dyslexia or dysgraphia or some other problem. But in a relatively light form of this visual perception, it could simply be slowing down your reading. So we are going to address this a little bit just to make sure those eyes are working together, and we want to see those letters as they are, not how we think they are. Number 4, auditory perception. Again, we want to look at this phenomenon of pattern recognition versus decoding. And either one is fine, but the truth is most people will find that if they can recognize the patterns of what they're reading, they're going to be able to read faster than by decoding, which is inherently a slow process. So we're going to try to introduce the reader, the student, to a style of reading that utilizes pattern recognition rather than decoding. Number 5, visual auditory integration. This is critical for comprehension. So you're seeing the words, you're hearing what you're reading, and you need to integrate that into one coherent piece of information that will allow you to understand what you're reading. And finally, number 6, sustained focus and attention. Again, we talked about this, that for some children, some children who may be described as having poor comprehension, they may in fact be struggling with poor retention. So we're gonna provide some skills and techniques to address that specific issue of retention. So number 1, again, visual sensing, vision, sight, the eyes. It's critically important that if someone's struggling, that this issue, their vision, be checked to ensure that they're seeing what's on the page. In addition to having each eye checked by an optometrist or an ophthalmologist, you may want to have the eyes checked by a developmental optometrist, particularly if the child is struggling, if you see them tilting their head when they read, if they're having trouble keeping their place or losing their place a lot when they read. These are a couple of symptoms that may indicate an eye tracking problem, which is the eyes functioning together. We are going to give you an exercise for helping with the developmental issue of the eyes working together. It's a simple exercise. It's not designed to cure any specific ailment, but it can assist with the eye tracking, which is an obvious requirement for effective reading. Again, number 2, auditory sensing. Have those ears checked if needs be. And especially if you have a child who maybe had chronic ear infections early on in life. They may in fact benefit from some speech or language or specific reading therapy.